Hello, I'm Alan. I'm the Senior Executive at SarcoidosisUK. We wanted to provide a bit of an update on some new information that we have been putting out over the last couple of days to try and give you advice and support around coronavirus. And we recognise that this is a really difficult time. We've had lots of people contacting with questions, and we want to do all that we can to make you feel as comfortable and as supported in this difficult time as possible. So first of all, yesterday evening we published a letter explaining our position on social distancing, our advice on social distancing. Lots of people have been contacting us with questions about it. Currently, our advice is that people with sarcoidosis should adopt social distancing as advised by the government. We do consider it to be a condition, an underlying condition which requires social distancing to keep people safe. We recognise that most people with sarcoidosis should be being advised to get a flu jab, so therefore they would fall under the category as defined by the government. So we think that's really important. We've had lots of questions from people saying, I think I should be social distancing based on the government's advice, but it is difficult for me to speak to my employer about that. So we've published this letter, which we hope people will be able to use to take to their employer, to take to a medical professional, to take to anyone else, to explain why they are vulnerable and hopefully help make sure that they're safe. Please let us know if you find it helpful. If you have any feedback, we're very open to that, but it'd be great to know if it is working and if it is working, who it's working with, who are you taking the letter to, and we can make any changes and update that as needed to make it as helpful as possible. Yesterday we also published a frequently asked questions page, an FAQ page on our website around coronavirus. So again, talking about our advice on social distancing, talking about contacting employers, and talking about medication as well. We've had people contacting us asking about changing their medication, particularly immunosuppressant medication. Our advice is that you should not be changing your medication unless you're speaking to a doctor. Understandably, that's difficult at the moment sometimes to speak to a doctor, but we do think that you should not be changing it at the moment. It's important that you continue to take medication which is helping to alleviate the symptoms of your sarcoidosis to keep you as safe as possible. And finally, we've also we're still putting out our badges. We are getting lots of orders and we're getting lots of people saying that they're really helpful. So we've got these badges here. We've got 3 different versions explaining people have a long-term lung condition, that they have a cough, that they have sarcoidosis, and people are saying it's really helpful for them to wear when they go to healthcare appointments, when they go to the shops, when they go on public transport, and hopefully that just makes people feel a little bit safer at the moment. As I said, we've got lots of people contacting us at the moment. Please feel free to continue to contact us by phone, contact us by email, and we will do our best to get back to you. We have the nurse helpline as always, who are trying to get through as many calls as possible. We are very busy at the moment, which I'm sure you can understand, but we'll do our best to get through all of those calls. So if you do have questions, please do get in touch. And again, if there's anything else, we've created these letters that we have on the website because in response to questions that people have had and to make sure that people have all the information that they need. So if there's anything else you think that we could do to help, then please do get in touch and we'll do our best to do that. I can see that there are a few people commenting, asking where the letter is. So if you go to sarcoidosisuk.org/coronavirus, that will take you to our main coronavirus page. On that we have the letter that I just mentioned, which you can give to employers. You'll have a link to the videos that we did with Dr. Rabina Coker, which I think are still relevant, although they were made a few weeks ago. We have a link to a letter which provides information for medical professionals should you contract coronavirus and need to go into hospital. That explains the condition and hopefully helps make sure that you get the best treatment when you're in hospital. And it also has a link to the badges, which I just mentioned as well. So we hope that that will be helpful. As I said, please do get in touch if there's anything that you're concerned about, if you want to speak to someone, or if you have any ideas for things that we can help do to make this difficult time a little bit easier. Okay, thank you so much for listening. Thank you so much for your support. This is a really difficult time for us as a charity. Normally we'd be gearing up to do lots of events and lots of fundraising, and so if you can donate anything, if you can take out a monthly direct debit to support the charity at the moment, that would be greatly appreciated, and it would help us continue to provide really important support at the moment, and to take on new projects which will support people. All right, thank you very much for watching, and please do get in touch. Thank you.